Hi, I'm Dr. John Chessare, the President and CEO of the GBMC healthcare system, and I'm here to give you an update on the coronavirus pandemic around the world, in Maryland and here at GBMC. So it's no surprise to anyone that the number of cases is surging up. And why is that? It's because we have a new variant called Omicron, and it is clear now that the Omicron virus variant is much easier to transmit from one human to another. The second reason why we're seeing more cases is because the weather has changed and people are now more likely to be indoors, surrounded by others. And when you are indoors, the ventilation system is not as good as it is out of doors. Out of doors, it is much harder for you to be infected with the virus if you come across someone who is carrying the virus. Now, the situation at GBMC mirrors what's been going on elsewhere. This morning, we have 38 COVID-19 positive patients in inpatient beds. 10 of those are in the intensive care unit, and I want to stress the next fact. None of the patients in the intensive care unit today have been vaccinated. And a sad note, we've had 2 deaths from COVID at GBMC this week, and neither of those people were vaccinated. I don't know what else to say to people that are talking about not getting vaccinated. There just is no evidence to support that. When you are not vaccinated, you are at greater risk of being hospitalized and dying, and you are at greater risk of transmitting the virus to others who may wind up in the hospital and who may die. So please speak with your loved ones directly, calmly, and respectfully to get them vaccinated. Now, the good news about Omicron is that the research that we now have suggests that on average, you are less likely to get very sick with Omicron. But the fact that the virus is more contagious is leading to many more actual cases. Now, this week, both the governor and the county executive of Baltimore County tested positive for coronavirus. They both tested positive because it was part of their routine screening. There's a message in this, and that is we should probably all act as if the people we are surrounded by are carrying the virus, because they've probably been immunized. They're not going to get very sick, but the virus is in their upper respiratory tract. We can't do anything about the weather, and we can't do anything about the virus being more contagious. But what we can do, and we've stayed on this point for the last few videos, is assure that we and our loved ones have been vaccinated. So if you've had a first series and you're eligible for a booster, but you have not yet had it, please get your booster as soon as possible, because the greater your immunity, the less likely you will contract the virus, the less likely you will get sick from the virus, and the less likely you will spread the virus to others. The other things we can do, we know very well. We can wear our masks. We can stay socially distant, especially if in the back of our minds we now know that even people who have been vaccinated may be carrying the virus, and we can continue to wash our hands. Coming into work today, I heard yet another interview with an emergency physician from the state of, this time it was Pennsylvania, talking about the state of affairs in emergency departments in the United States of America. As we all know, the emergency department is there to rescue people with emergencies. Over the years, it has also become the place where people with chronic disease and real needs go because they have no other choice, because the healthcare system is not able to deal with them in a more proper place. At GBMC, we are working very hard to make sure that we can accommodate anybody with a primary care need if they are our patient in our primary care offices, and we are doing the same for specialty patients. We only want people in the emergency department who really have an emergency. Over the last week, GBMC and many other emergency departments have broken all-time records for the number of patients seen. Please use the emergency department if you truly have an emergency. If you have another need, please call your doctor. GBMC will be standing up the capability for COVID testing, not in the emergency department. We need to unburden our fabulous ED doctors and nurses from people who do not have emergencies. Why? So that we can get to the people who really need us. Right now, we are concerned that people without COVID will not be able to get the care they need because we are overwhelmed with people who have COVID or who are just looking for a COVID test. So thank you very, very much. I also want to comment on the visitor policy. Like many other hospitals, GBMC has gone back and reviewed its visitor policy, and we have determined that we will continue to allow one visitor per patient. We would ask that you go to www.gbmc.org for further information about our changes to our visitor policy. We look forward to the day that we can be open to all visitors again, but right now, for the safety of our patients, our workforce, and the community, we've needed to go back to a more restrictive visitor policy. Thank you. So for those of you who celebrate it, I wish you a very Merry Christmas, and to everyone, a very peaceful and joyful holiday season. And finally, another shout out to healthcare workers. You have been spectacular in your efforts fighting the pandemic. Thank you.